Dear students, I am Dr. Sunantha, Associate Professor from the Department of Prosthodontics, Vinayaga Mission Shankaracharya Dental College, Salem. Today my topic for presentation is components in implant dentistry. The implant dentistry is a boom in the field of dentistry. It is a successful treatment option for the replacement of the missing teeth. According to Glossary of Prosthodontics, implant prosthodontics is defined as a phase of prosthodontics concerned with the replacement of the missing teeth or the associated structure by restorations that are attached to dental implants. The aim of today's topic is to introduce our students about the various components of implant dentistry. Coming to the steps in the implant treatment, the first is the treatment planning. This treatment planning is done using a CBCT. This plays a vital role in the success of implant treatment. Then comes the surgical phase, where the implant is placed in the edentulous area with a proper sterilization protocol. Last comes the prosthetic phase, where the missing teeth is replaced with the restoration and it is attached to the implants. This restoration is present in the intraoral region. The implant system is basically divided into implant fixture component, which is present within the bone. Then comes the transmucosal component, which is present in the mucosal area, and then the actual prosthesis, which is seen intraorally. Let's first talk about the implant fixture. The implant fixture is a component which is made up of a titanium alloy, which has the physical, mechanical and the biological property which is enhanced and improves the osseointegration. This implant fixture is made up of three parts. One, the apex region, the body and the crest of the implant. First, let's start with the apex region. The implant apex is often tapered, which helps in the initial placement of the implants during the osteotomy sites. The apex may also be parallel or it can be cylindrical. The apex region may have vents, grooves, flat surfaces, holes, which gives an anti-rotational features for the implant. Moving on to the body of the implant, it is usually a root formed implant which has threads, structured, which is etched and also coated with plasma or hydroxyapatite. These surface irregularities increases the surface area of the implant body, thereby improving the osseointegration. Next comes the crestal module. This represents the transitional zone of the implant system. The crestal module influences the surgical phase, it controls the bacterial accumulation, influences the biological width and increases the load profile of the prosthesis and also influences the prosthetic components. The crestal module acts as the implant abutment interface. This crestal module ensures the joint strength, joint stability and also provides the rotational stability to the prosthesis. The implant module comes with two types of connections. They are the external connection and the internal connections. They offers the physical resistance to the axial occlusal forces. Coming to the external connections. These external connections are the connection which is present superior or external to the surface of the implant. So this particular connection has lots of disadvantages. So nowadays these kind of connections are not being used. Then comes the internal connections, where this is commonly used because the connection lies within the implant body as such. Based upon the companies, the internal connection have different shapes like trichannels, hexagon, octagon or even the conical connections. All these internal connection enhances the anti-rotational property of the prosthesis. Next, coming to the surgical phase of implant, where the implant fixture is placed within the bone and with the appropriate osteotomy, the crestal module of the implant fixture is closed using the cover screw. The cover screw prevents the bone, soft tissue and the debris invading the abutment connection area during healing. The implant is allowed to heal for a period of 3 to 6 months. The clinical picture here shows the implant site, and now the implant enters the second surgical phase, where the implant platform is switched from the bone level to the tissue level. Once the osseointegration is ensured, the implant is re-exposed and the cover screw is replaced with the healing abutment. This healing abutment gives a healthy aesthetic emergence profile of the soft tissue around the implant prosthesis. After 10 to 15 days, once the soft tissue is healed, the healing abutment is removed. In this picture shows the good soft tissue contour and gives a good emergence profile for the prosthesis. Now the exact implant position and the orientation of the implant from the mouth has to be transferred to the working cast. This is possible with a special type of impression technique. Now let's dive into the prosthetic phase of implant dentistry. The implant analog is a component which exactly replicate the implant platform and the connection. The inner surface of the implant analog exactly replicates the inner surface of the implant as such. So this implant analog helps to incorporate all the prosthetic components during the laboratory phase, and this acts as a working cast for the fabrication of the prosthesis. Next, let's talk about the implant impressions. The implant impression is a special type of impression technique wherein we use the implant impression posts for making the impressions. We have two types of impression posts which aids in transforming the spatial orientation of the implant position accurately to the working cast. They are closed tray and open tray impression copings. The closed tray impression coping has a shallow retentive grooves which is along the body, and also it has a short screws and the neck of the screw is very short. Whereas an open tray impression post, it has a retentive grooves or the wings along its body and a long connection screws. In the closed tray impression technique, as the name suggests, we use a stroke tray or a regular custom tray to make the impression. Let me now brief you about the closed tray impression technique. The healing abutment is replaced with the closed tray impression coping, and care should be taken that the flat surface of the impression posts are placed labially or facially. Using the stroke tray and an elastomeric impression material, the impression is made. The complete post remains within the impression and no part of the post emerges out of the tray. Once the impression is made, the closed tray impression post is removed from the implant assembly and then it is assembled to the implant analog. The whole assembly is then reinserted into the impression with the same orientation. A gingimimic material is flown on and the cast is fabricated. So the cast obtained is ready for to receive the prosthetic component. Next comes the open tray impression technique, where we use a custom tray or a stock tray with an opening or a window corresponding to the implant impression posts. This video illustrates how to do an open tray impression technique, and healing abutment is replaced with an open tray impression post. A part of a long screw emerges out of the impression tray and it should be unscrewed before removing the impression from the mouth. Here the video shows an impression tray which has a window and the screw is removed from the impression while removing. The analog is then connected to the assembly using the long screw. An gingimimic material is flown into the impression and the cast is fabricated. The long screw is again unscrewed to withdraw the cast from the impression. In this situation, the post remains within the implant and the wings in the body of the post provides the retention and gives an anti-rotational property for an implant posts. In the situations where there are multiple implants placed, An open tray impression technique is a better choice because it gives a better accuracy. Then we are going to talk about the implant abutment. The implant abutment is a portion of that which supports or retains the prosthesis. Implant abutment can be classified as straight or angled abutment, stock or customable abutment, metal or zirconia abutment. There exists a special type of abutment called as a multi-unit abutments. The multi-unit abutments are usually placed in an area where the implant is placed very deep, or the implant is angulated, or if the thickness of the implant is more. This is a multi-unit abutment which is placed inside the implant body. Here, this multi-unit abutment brings the surface of the implant body from the bone level to the tissue level. This multi-unit abutment is placed in a situation where the soft tissue is thick when there are multiple implants placed, and in order to bring parallelism between the implants. So here you can see the multi-unit abutment is being tightened using a torque wrench with 35 newtons. We also have an angled multi-unit abutment, and the angle varies between 17 degree, 20 degree, 25 degree and up to 35 degrees based upon the manufacturers. These angled abutments are used to align the prosthesis parallel when the implant is placed in a different angulation. It restores the restorative platforms. Here is a case which shows an osteotomy site where the different drills are placed and then the implants are placed inside. You can see a hexagonal connection which is the crustal module of that particular implant, and you can see the healed implant site. Once the implant is healed, we are then placing the healing abutment and then suturing it back. Once the healing abutment is placed, the impression is made, and this is the final prosthesis of the patient. So there is a wide range of variety of implant component present, which often acts as a hurdle for the new dentist to actually operate and understand implant dentistry. So to summarize, here are the components which we have looked on: the implant body, the cover screw, the healing abutment, then comes the transfer coping. The transfer coping can be an open tray or a closed tray transfer coping, and this is the abutment. Abutment can be a screw retain or a cement retain, and here comes the implant analog, and here is the prosthetic screws. So these are my references. Thank you for hearing my class.